Chapter 7. The Male Reproductive System. Let's discuss the male reproductive system. The male reproductive system is divided into three main categories of organs: primary, secondary, and accessory. The testes are the primary sex organs, responsible for producing sperm and secreting male sex hormones like testosterone. These organs are involved in the transport and delivery of sperm. They include penis, functions in the delivery of sperm to the female reproductive tract. Scrotum, maintains an optimal temperature for sperm production. Epididymis, stores and matures sperm. Vas deferens, transports sperm from the epididymis to the urethra. Urethra, serves as a shared passage for semen and urine, but not simultaneously. Also, there are several accessory glands in the male reproductive system. These glands produce secretions that support and nourish sperm and aid in their transport. Prostate gland produces a fluid that enhances sperm motility and viability. Seminal vesicles secrete a fructose-rich fluid to provide energy for sperm. Bulbourethral, or Cowper's glands, release a lubricating mucus to neutralize acidic residues in the urethra. Epididymis, EPI, means above or on. Didymis refers to testes. Definition: the epididymis is the tube located on top of the testes that stores and transports sperm. Seminal vesicle. Semensa refers to semen. Al, a suffix meaning pertaining to. Vesic means sac containing fluid. Definition: the seminal vesicle is a sac-like structure that produces and stores seminal fluid, a component of semen. Vas deferens. Vas means vessel or canal. Deferens means carrying away. Definition: the vas deferens is the duct that carries sperm from the epididymis to the urethra. The major structures within each testis, including lobules and seminiferous tubules. The spermatic cord, showing its connection to the testes and the structures it contains. Location of the testes. The testes are housed within the scrotum, suspended outside the body to maintain a lower temperature essential for sperm production. The testes are divided into lobules, which contain coiled seminiferous tubules. These tubules are the site of spermatogenesis, where germ cells mature and develop into sperm. Function of the seminiferous tubules. The seminiferous tubules are lined with cells undergoing the process of sperm production. This includes mitosis, to produce more germ cells. Meiosis, to create haploid sperm cells. The spermatic cord is a structure that connects the testes to the body. It contains blood vessels to provide nutrients and oxygen, nerves to sensory and motor supply for the testes, and a duct called the vas deferens for sperm to travel from the testes to the urethra. Let's talk about the functions of testosterone. During fetal life, testosterone stimulates the development of the male reproductive tract. In adulthood, it sustains the male reproductive system. Testosterone promotes the maturation of germ cells into spermatozoa within the seminiferous tubules. Testosterone stimulates the development of facial and body hair, increases muscle mass and bone density, contributes to the growth spurt during puberty, and testosterone deepens the voice by promoting growth of the larynx. In addition, testosterone suppresses the production of female hormones in males, helping maintain a balance of male hormones. And that covers the primary functions of testosterone. Powerful influences on male development and physiology. Spermatozoa, commonly called sperm, are the male reproductive cells. Each spermatozoon has a head that contains genetic material, a midpiece packed with mitochondria for energy, and a tail for movement. This design helps the sperm navigate toward the egg for fertilization. Spermatogenesis is the process by which sperm cells are produced in the testes, within the seminiferous tubules. It involves several stages: mitosis, meiosis, and differentiation, transforming germ cells into fully mature spermatozoa. Flagellum, flagella, singular. Flagellum refers to the tail of a single sperm, which provides motility. Plural. Flagella are the tails of multiple sperm cells. Spermatozoa. Singular. Spermatozoa is a single mature male sex cell that is capable of fertilizing an egg. Plural. Spermatozoa refers to multiple mature sperm cells. Testes. Singular. Testis is one male sex organ responsible for sperm production and hormone secretion. Plural. Testes refers to the pair of male sex organs located within the scrotum. T's talk about the spermatic ducts. They form the pathway for spermatozoa once they leave the testes, guiding their maturation, storage, and eventual release. The spermatic ducts form the pathway that spermatozoa follow after they exit the testes, facilitating their maturation, storage, and eventual ejaculation. The epididymis arises directly from the testes and plays a critical role in sperm development. Spermatozoa mature here, gaining motility and the ability to fertilize an egg. The vas deferens, also known as the ductus deferens, begins at the epididymis. It travels upward, entering the pelvic cavity through the inguinal canal. This tube serves as the main conduit for transporting sperm from the epididymis toward the urethra. The ejaculatory duct is formed where the vas deferens meets the duct of the seminal vesicle. This short duct connects to the urethra, allowing sperm to mix with seminal fluid before ejaculation. Prostatic. Definition. Prostate, noun, refers to the gland in the male reproductive system that produces a component of seminal fluid. Prostatic, adjective, pertains to the prostate gland, e.g., prostatic enlargement refers to the abnormal growth of the prostate. Seminal. Definition. Semen, noun, the fluid that contains sperm and secretions from the male reproductive glands. Seminal, adjective, relates to semen, e.g., seminal vesicles are glands that produce a significant portion of the fluid in semen. Reproductive. Definition. Reproduction, noun, the biological process by which organisms produce offspring. Reproductive, adjective, relates to the process or organs involved in reproduction, e.g., reproductive system refers to the organs responsible for producing offspring. Cryptorchidism is a condition where one or both testes fail to descend into the scrotum during fetal development. Testicular torsion is a medical emergency caused by the twisting of the spermatic cord, cutting off blood supply to the testis. Varicocele isa, an enlargement of the veins within the scrotum, often leading to reduced fertility. Hydrocele is an accumulation of fluid around the testicle within the scrotum, causing swelling. Spermatocele is a cyst that develops in the epididymis, containing sperm and fluid. Epididymitis is an inflammation of the epididymis, typically caused by bacterial infection or sexually transmitted infections. Orchitis is an inflammation of one or both testes, often due to viral or bacterial infections. Testicular cancer is a malignant growth in the testicles, commonly presenting as a painless lump or swelling. Early detection greatly improves prognosis. Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate gland, commonly occurring with aging, which can obstruct urine flow and cause urinary symptoms. Prostate cancer is a malignant tumor in the prostate gland, often slow-growing, but in some cases, aggressive and life-threatening if untreated or metastasized. Prostatitis is the inflammation of the prostate gland, which can be bacterial, acute or chronic, or non-bacterial, causing pelvic pain, difficulty urinating, and sometimes flu-like symptoms. Choriocarcinoma. Root. Chorio refers to the chorion, the outer membrane surrounding the embryo. Carcin refers to cancer or a malignant tumor. Suffix. Oma means tumor or mass. Definition. A malignant tumor of the chorionic tissue, often associated with the placenta during pregnancy. Seminoma. Root. Semen refers to semen or sperm. Suffix. Oma means tumor or mass. Definition. A malignant tumor of the testis originating in the sperm-producing cells. Teratoma. Root. Terat refers to monster or abnormal growth, derived from the Greek word for monster, often referring to mixed or bizarre tissues. Suffix. Oma means tumor or mass. Definition: a tumor that may contain different types of tissues, such as hair, muscle, or bone, often occurring in the testes or ovaries. Male infertility can arise from several underlying causes. Let's explore the most common ones. Impaired sperm production. Causes: genetic conditions, such as Klinefelter syndrome, testicular injury or infection, such as mumps orchitis, varicocele, or enlargement of veins in the scrotum affecting temperature regulation, exposure to environmental toxins, such as radiation, heavy metals, or chemicals, lifestyle factors, such as smoking, alcohol use, or anabolic steroid abuse. Impaired sperm delivery. Causes: blockages in the reproductive tract, such as congenital absence of the vas deferens, post-infection scoring, erectile dysfunction or ejaculatory disorders, such as retrograde ejaculation, anatomical abnormalities, such as hypospadias, past surgeries, such as vasectomy or pelvic procedures. Testosterone deficiency. Causes: primary hypogonadism from injury or radiation. Secondary hypogonadism occurs due to pituitary or hypothalamic dysfunction affecting hormone production. Aging causes natural decline in testosterone levels. Chronic conditions like obesity, diabetes, or metabolic syndrome. Let's define some common medical abbreviations. ED stands for erectile dysfunction, a condition where a man is unable to achieve or maintain an erection suitable for sexual activity. STD stands for sexually transmitted disease, which refers to infections spread through sexual contact, such as chlamydia, gonorrhea, or syphilis. CCO means complains of, used to describe symptoms reported by a patient, such as C/O chest pain. SET stands for self-examination of the testes, a procedure where individuals check their testes for abnormalities, such as lumps, which could indicate testicular cancer. Understanding these abbreviations helps ensure clear and effective communication in medical settings. Let's discuss the procedure and pharmacology for the male reproductive system. Let's review key diagnostic and therapeutic procedures related to male reproductive health. Diagnostic procedures include: digital rectal exam involves using a lubricated, gloved finger inserted into the rectum to assess the prostate gland for abnormalities. Prostate-specific antigen (PSA) test measures the level of PSA, a protein produced by prostate cells, in a man's blood. Elevated levels may indicate prostate cancer or other prostate conditions. Prostate biopsy, typically performed under ultrasound guidance to remove small tissue samples for analysis, especially when prostate cancer is suspected. Therapeutic procedures include: circumcision is the removal of the foreskin, often performed for medical, cultural, or religious reasons. Orchiopexy is a surgical procedure to move an undescended testicle into the scrotum and secure it. Orchiectomy is the surgical removal of one or both testicles, often performed to treat testicular cancer or reduce testosterone in prostate cancer cases. Urethrotomy is an incision of the urethra to treat strictures or obstructions. Vasectomy is a procedure performed under local anesthesia to cut and remove a portion of the ductus deferens, preventing sperm from reaching the semen. The reversal is called a vasovasostomy, which reconnects the severed ends. Prostate cancer treatment options include: radiation therapy or brachytherapy to target cancer cells using external or implanted radiation sources. Cryosurgery to freezes and destroys cancerous tissue. Prostatectomy for surgical removal of the prostate gland. Chemotherapy to use drugs to destroy cancer cells. And lastly, proton beam radiation therapy as a precise form of radiation therapy that targets prostate cancer while sparing surrounding tissues. Understanding key distinctions in medical terminology enhances clarity and accuracy. Let's contrast the following sets of terms. Here we have anarchism and cryptorchism. Anorchism, a condition where one or both testes are absent, either due to a congenital anomaly or surgical removal. Cryptorchism, a condition where one or both testes failed to descend into the scrotum during fetal development. The testes are present but improperly located. Next, infertility and sterility. Infertility, the reduced ability to conceive or achieve a successful pregnancy after 1 year of regular, unprotected intercourse. Fertility may still be possible with treatment. Sterility, the complete inability to conceive or impregnate, often due to irreversible causes, e.g., surgical removal of reproductive organs or permanent damage. Lastly, vasectomy and vasovasostomy. Vasectomy, a surgical procedure where the vas deferens is cut or sealed to prevent sperm from mixing with semen, effectively serving as a permanent method of male contraception. Vasovasostomy, a surgical reversal of a vasectomy, reconnecting the vas deferens to restore the flow of sperm and potentially reverse infertility. By understanding these distinctions, healthcare providers and patients can communicate effectively, ensuring informed decisions and appropriate care. Let's define some key abbreviations commonly used in urology. DRE stands for Digital Rectal Examination, a procedure where a healthcare provider uses a gloved, lubricated finger to check for enlargement or abnormalities in the prostate gland. PSA stands for prostate-specific antigen, a blood test that measures the level of PSA, a protein produced by prostate cells, to help detect prostate cancer or monitor prostate health. BPH stands for benign prostatic hypertrophy, a non-cancerous enlargement of the prostate gland, which can cause urinary symptoms in men. TURP stands for transurethral resection of the prostate, a surgical procedure performed to treat BPH by removing part of the prostate through the urethra.